Okay, we are live, and this is another edition of Dr. Yass on YouTube Live. Today, we're going to be talking about core strengthening. And this has been around for a while, and it has been promoted as this incredible aspect of strengthening that supposedly cures all. It's incredible for helping with back pain. Unfortunately, I have treated innumerable people who went to the medical system, typically physical therapy, and core strengthening was promoted as the primary type of exercise, and magically the person didn't get better and wondered why. And so I felt like we really needed to have an opportunity to examine what is core strengthening, why it doesn't work, and what the alternatives are to addressing lower back pain, especially with the fact that 98% of cases of lower back pain are muscular based. So I wanted to start off by talking about what is core strengthening. And I think that there's a lot of question as to what people are talking about when they are talking about core strengthening. People have told me, oh, it's really just another word for abdominal strengthening. Some people say that it's abdominal and lower back strengthening. Some people will describe it as including the abdominal region, the lower back, and even some hip issues, hip strengthening. But primarily, I think most people associate core strengthening and core training with the idea of strengthening the abdominals and the lower back. And I wanted to talk about that and why they really have very limited impact on addressing lower back pain. So why don't we start with just trying to understand what the abdominal cavity is? I think that's probably a good thing to begin with. So let me just show you a picture of this. I thought this was a really good picture. This is the abdominal cavity. And as you can see from the side view, you can see this is all your viscera. And here's the abdominal sheath. And here's the lower back muscles. So the abdominal cavity basically runs from the bottom of the rib cage to the top of the pelvis. Here's the top of the pelvis, and the bottom of the rib cage would be there. Okay, so that's the abdominal sheath. That's the abdominal cavity. And what I want to point out is that the abdominal sheath is primarily responsible for keeping the abdominal viscera in the abdominal cavity. It really has very limited capacity to be able to affect stability of the torso. It's very, very thin. It primarily is here just to keep the abdominal viscera encased in the abdominal cavity. I'd like to kind of represent or show just how thin the abdominal sheath is. So here's a cross-sectional view of the abdominal cavity. This is the front of the abdominal cavity. This is the back of the abdominal cavity. Now look very carefully here. Look at how thin the abdominal sheath is. Look how small that is. In comparison, this is your lower back muscles. Look how thick the lower back muscles are. Look how thin the abdominal sheath is. So the idea that this aspect of the abdominal cavity, the abdominal sheath, is going to be able to impact stability here, just look at the size of that. Look how thin this is. Look how thin this muscle is. Isn't it more logical that this abdominal sheath is really designed just to keep this abdominal viscera secured in the abdominal cavity? Just from the perspective of looking at it in a size perspective, it should be clear that it would have very, very limited ability to affect stability and pain at the lower back. So that should hopefully make people question whether doing abdominal exercises, first off, you'd have to do the abdominal exercises correctly. And the stuff that you see at the gym and being promoted in physical therapy is typically not correct. The exercises that are being done, for instance, people will be shown that they need to do a full sit-up, or in the gym, you'll see them doing the leg pull-ups. They're holding on to something and they're bringing their knees up. If you notice when you do a full sit-up, or whether you're bringing your knees up, you would see that if this is the torso and this is the thigh, the angle between the torso and the thigh is changing. It's becoming more acute and obtuse, acute and obtuse. Anytime there is a change in angle between the torso and the thigh or the leg, that motion must be occurring at the hip joint. The abdominal muscles have no capacity to affect the hip joint. The abdominals, the muscles attach from, as I told you, the top or the bottom of the rib cage. They attach from the bottom of the rib cage to the top of the pelvis. So it's the bottom of the rib cage to the top of the pelvis. Okay? So in that respect, the abdominals can do no more than bring you from an anterior tilt, which is an excessive arching, to a posterior tilt, which is a hunching. So the abdominal muscles can do nothing more than change the posture of the torso, which to say it can take it from an arched position to a hunched position. But in both of these cases, if you notice, the angle between the torso and the thigh never changes. So anytime you see anybody promoting an exercise and describing it as an abdominal exercise, and there is some change between the torso and the leg, you can guarantee that that is a hip exercise and has nothing to do with strengthening of the abdominals. Diane wrote, I love this information, and you can see celebrities with great abs that have back pain. Right, right. But just because you have great abs, typically that you see your abdominals doesn't mean that you have a balance of muscle between your abdominal sheath and your lower back muscles. It just means that there's a very low percent of body fat, which allows the individual's abdominals to be seen. But in terms of posture, whoever this person is, Chris Hemsworth, I don't know who that is, but okay. If we take him as an example, I would guarantee you that if you looked at his posture, this is the posture you're going to see. He's going to have an excessive arching of his lower back, just like that. Okay? And that's because the guy probably has no understanding of how to strengthen the abdominal muscles. And so he's actually sustaining an imbalance between the abdominals and the lower back muscles, which are leading the lower back muscles to shorten, thereby creating an excessive arching in the lower back. The shortening of the lower back muscles, along with the psoas muscles, are what are creating pain in the lower back. Here is that picture that I like to show. This picture is showing the psoas muscles, which attach to all 5 lumbar spine and go all the way down to the hip. And off to the side are the QLs, quadratus lumborum. These are your lower back muscles. Okay? So these muscles run from the lumbar spine to the hip, or from the bottom of the pelvis, the bottom of the rib cage to the top of the pelvis. If you imagine having a situation where you end up with excessive arching, what that basically means is that the bottom of the rib cage is going to come closer to the top of the pelvis. In that occurring, these muscles will have a tendency to shorten, and when muscles shorten, they have a tendency to strain and elicit pain. In more than 98% of cases of lower back pain, I have been able to show that the cause of the pain is a strained quadratus lumborum or psoas muscle. This is occurring because a person should have a very subtle arch in the lower back, but because these muscles are shortening, it's creating an excessive arch in the lower back, which is allowing these muscles to shorten and strain and elicit pain. The preposition of core strengthening or core training is that in strengthening the abdominals, because the abdominals are the opposing muscle to the lower back muscles, that you could somehow achieve balance. In achieving balance, supposedly, you'll be able to take that excessive arch and bring it to a more neutral position. So when I show you the presentation of the abdominal sheath and you see it's so thin, especially in comparison to the lower back muscles, why would you think that it's possible that in strengthening this sheath that's this thin is going to be able to offset the force of muscles this big? The answer is it couldn't, which is why core training cannot resolve lower back pain. And it's pretty much impossible for anyone to develop an equivalent amount of abdominal strength as lower back strength. Just understand this premise. There basically is no chance that if you're in an excessive arch in the lower back, which has come from shortening of the quadratus lumborum muscles, low back muscles, or the psoas muscles, that strengthening the abdominal sheath will ever be able to offset that imbalance and that shortening. I want everybody to recognize this. This is one of the most important things you can understand about lower back pain. You're going to go to a lot of practitioners. You're going to go to a lot of fitness people, and they're all going to tell you that core training is a critical component. I am here alone to tell you through a presentation of scientific evidence that this is a 100% fallacy. And you kind of just don't have to take my word. I mean, pretty much anybody who's attempted to resolve their lower back pain by doing core training, it has failed. So we want to try to take it from another angle and say, well, okay, if it's not core training and strengthening of the abdominals, what can work to achieve the goal? So we'll go back to this picture here, and we want to kind of look at this. This is your pelvis here, okay? And there are 2 points that you want to look at on the pelvis to tell you whether your pelvis is level, pointing down in the front, or pointing up in the front. And it's 2 points here. This is called the anterior superior iliac spine, and this is called the posterior superior iliac spine. And they could be actually identified on your pelvis. You can literally feel them. They're 2 bony prominences. One is in the front, one is in the back of the pelvis. Now, when you're in a neutral posture, these 2 points should be level. But if you're in an anterior tilt, as the picture shows, the front point, the anterior superior iliac spine, is going to point down. And in the pelvis going down, it creates arching of the lower back. If we're looking at the posterior tilt, now you can see the posterior iliac spine is lower than the anterior. So now in the pelvis rotating back, you create hunching, a loss of arch. Okay? So if you understand that the idea of the positioning of the lower back is directly correlated to the position of the pelvis, it's not arbitrary. This doesn't just happen. The arching or hunching or maintenance of neutral posture at the lower back is directly correlated to the position of the pelvis, primarily because you're standing. And so the transition of forces from the lower back go through the pelvis to get down to the ground. So there is a direct connection between position of the pelvis and position of the lower back. So if we understand that control of the lower back is controlled by, or is controlled by the pelvis, then we now have to start to say, well, what can control the pelvis? That brings us to the next and most important photo or illustration, which is right here. Here is your abdominals. Here is your lower back. Here is your pelvis. What attaches to the pelvis in the front? The quadriceps muscle. What muscle attaches to the pelvis in the back? The hamstrings. The quadriceps below the pelvis attached to the pelvis in the front. The hamstrings below the pelvis attached to the pelvis in the back. So, what if the quadriceps muscle got stronger than the hamstring muscle? The quadriceps would shorten, and what would it do to the front of the pelvis? It would pull it down. If it pulls it down, go back to this. If this gets pulled down, what happens to the back? The back arches. If the back arches, what happens to the quadratus lumborum and the psoas muscles? They will shorten. Remember, arching implies that the distance between the bottom of the rib cage and the top of the pelvis will come closer together, which will cause these to shorten, strain, and elicit pain. So if we go through these three illustrations, the cause of lower back pain and the change in pelvis, which is another symptom, are a representation of a muscle imbalance between the quadricep muscle and the hamstring. So what most people are recognizing is that lower back pain is the result of an imbalance between the muscles of the thigh, which lie below the pelvis. Everybody who's trying to promote core strengthening is trying to tell you that the issue that needs to be addressed occurs above the pelvis. The abdominals are weak in comparison, and therefore you need to strengthen them. That is physically impossible. You can never strengthen your abdominal muscles to the equivalent strength of the lower back muscles, because all you have to do is look at the size. Here, that's the abdominal sheath. That's the lower back muscles. Look at the size of those monsters. Clearly, these are going to be much stronger than these. There's no way you could thicken this up to match that. This picture is a representation as to why core training must be baseless. Just look at this. This is real. This is a representation of your abdominal cavity. There is no question you will ever get enough strength here to match the strength here. Therefore, there's no way that you can balance these to maintain the length of these muscles. Right? Those muscles are attached to the pelvis. Well, I guess we could show it here. Right? Here is your QL. It is literally attached to your pelvis. And the psoas passes the line of the pelvis. So altering the position of this, if this goes down, forward, well, that's going to actually shorten these because it gets closer. If this goes into a posterior tilt, it lengthens it, the distance between the rib cage and the pelvis. Right? So the only thing that you could address is the positioning of the pelvis to make sure these maintain their optimal length. And how do you control the positioning of the pelvis? It has to do with the muscles that sit below the pelvis and attach to the pelvis. Here are your quadricep muscles, and you can clearly see it's attaching to the pelvis. Here's the hamstrings. If you pull back the gluteus maximus, that pelvis wraps right to here, and the hamstring is attached to it. So if you want to control the position of your pelvis, preventing it from pulling too far forward or too far back, maintaining a subtle arch in the lower back, maintaining the length of the QLs, the lower back muscles, and the psoas muscles, you must maintain balance between the quadriceps and hamstring muscles. If you were to do a test feeling for those two bony landmarks, the anterior superior iliac spine and the posterior superior, and you found that the ASIS is lower than the PSIS, you would see that correlated to a severe arch. That's telling you stretch your quads and strengthen your hamstrings. Once the quads are stretched and the hamstrings are strengthened and the muscles balanced, you'll bring that pelvis to a neutral position. The attachment of the QL from the bottom of the rib cage to the pelvis and the psoas running by it will now be maintained at your optimal length. Pain is gone. No pain in the lower back. I don't think I need to invest a lot of time in this particular session describing the fact that the MRI is baseless, and any attempt to try to convince you that the cause of your lower back pain is some structural variation that could be identified, like a herniated disc, stenosis, or arthritis. We've recognized that the Yass method is the only method that is promoting the abolishment of the use of MRIs for diagnosing the cause of pain. In a prior episode and video, I presented the evidence that came from 2007, the American College of Physicians. This the largest body, medical body that guides the way physicians perform their duties, had a 40-year literature search which reinforced this point and actually recognized that 85% of people going to seek care have what is known as nonspecific lower back pain. And with nonspecific lower back pain, the recommendation was that an MRI not be performed to identify the cause of the pain, because outcomes were shown to be of no consequence when a diagnostic test found a structural abnormality. There was no improvement of outcomes when that was actually achieved. So we just need to leave it there. You have to accept the idea that the highest probability is that that pain in your lower back is muscular, primarily from two muscle groups, the quadratus lumborum, the lower back muscle, or the psoas muscle. If we accept that it's from the fact that they're shortened because you're in an excessive arch, stretch the quads, strengthen the hamstrings. If you're in a posterior tilt, we actually check, and the ASIS is higher than the posterior, so the front of the pelvis is actually pointing up, and you would see a correlative flattening of the lower back. In that case, we want to do just the opposite. Stretch the hamstrings, strengthen the quads. But I would say that at least probably 90% of people are in an anterior tilt. It is highly unusual for someone to have stronger hamstrings than quads. The only typical reasons are some sort of injury, an incident that left the quad strained, or, I hate to say it, failed surgeries, knee surgeries. Almost always, after a person gets a surgery to the knee, they never quite seem to get that quadricep strength back, which can now lead to the hamstring being stronger and shorter, which leads to that posterior tilt. But primarily, most people are in an anterior tilt. Too much quad over hamstring. In terms of the actual exercises to perform, so a quadricep stretch is pretty straightforward. To see exactly how to do the stretch, you could purchase one of my books, over the Pain Cure RX or the Yass method for pain-free movement. Both have pictures on how to stretch and perform exercises. In terms of hamstring, the primary exercise is the hamstring curl, typically done in sitting, or the straight leg deadlift. Again, these exercises can be seen how to perform in the two books, the Pain Cure RX or the Yass method for pain-free movement. That's primarily the means by which you will be able to resolve your lower back pain. Please understand, from a scientific perspective, this isn't opinion. I rarely, if ever, speak on opinion. Everything I present is science-based, and then followed through by 27 years of empirical data with over 15,000 people that I've treated. I treat based on what is logical, what can be derived from science-based understanding. Then I apply it and perform it and confirm that my understanding is clear and accurate by seeing the results. That's what makes this very different. Everybody else is just taking what they've learned in school and just doing it. The sad part is it's what they're doing, and their education is baseless. There's no understanding, no validity, no scientific entrenchment. And that's why nobody gets better. And that's why I'm out here doing this stuff, trying to get these videos out there, trying to get this channel out there. Very, very exciting. Very, very exciting. 2 days ago, or actually yesterday, I got contacted by email from someone in India who actually is interested, a medical doctor who's interested in having me do some sort of seminar or workshop, and is interested in possibly having me do some sort of treatments for some of the patients over there. That's the kind of stuff that reinforces that what I'm doing has value, and it is getting out there. And I will continue to push this until everybody who's looking to have their pain resolved has the chance to see something scientific outside of the medical system. Diana wrote, I wasted so much time doing core exercise and physical therapy, and I never could really do straight sit-ups anyway, which is probably for the best. Right. Straight sit-ups is really activating your hip flexors. So you'll see all these people in the gym, and you'll see that they're doing those exercises where they're holding on to something and they're pulling their knees up and they think they're doing their abdominals. And then you see them walk and they're in the most extreme anterior tilt, which actually is leading to back pain. And they wonder, I don't understand. Why am I in the anterior? Because you're not strengthening your abdominals. You're actually strengthening your hip flexors, your psoas muscles. And what did we talk about? If the psoas muscle shortens, it's going to create an excessive arching, pulling the rib cage, the bottom of the rib cage, down to the top of the pelvis. It's literally going to take its attachment of the lumbar spine and pull it forward. That's what they're doing to themselves. There's so much misunderstanding, misinformation. And the scariest part is those that are being cast as having the expert understanding are doing all the wrong stuff themselves and presenting themselves as doing it incorrectly. And it really leads the person to say, so where can I get information that will help me? And Diana would be the first to attest to the fact that it's the Yass method. The Yass method, because it sits outside the medical system, sits outside the fitness system. Nothing is done without a strong scientific basis. All theory that is based in science, followed by empirical data from 27 years and 15,000 people. The success rate is so high, it's unmatched. No one can do this. And it's not a question of gloating. It's a question of satisfaction in the sense that I've developed something that I believe can truly help 130 million Americans and roughly 1 billion people worldwide. It's really just about awareness. Anyone who gets to see this, anyone who becomes aware of the Yass method says, wow, that makes so much sense. Right. It does, and it will continue to, because it's so entrenched in science. So I think that's a really, really good presentation. Many people do those Mckenzie Exercises. What do those exercises do? Very funny that you would say that. That's a great point. So that's another one, right? So you go to physical therapy and you're told to do the Mckenzie Exercises. What are those exercises? Extension exercises. I forgot to talk about that. Not only does trying to strengthen the abdominal muscles fail, but there's multitudes of people trying to convince people to strengthen the lower back muscles. And as we saw from that cross-sectional view of the abdominal cavity, the lower back muscles are gigantically bigger than the abdominal muscles, the abdominal sheath. So in trying to strengthen the lower back muscles, what you're doing is reinforcing the imbalance. And there's actually a back extension machine in the gym that people constantly are getting on. And it's actually feeding into their problems. Lower back pain will be made worsened by strengthening the lower back muscles. And that seems counterintuitive to people. Oh, I would think I'd want to strengthen my lower back muscles. Not when your lower back muscles are already so much stronger than your abdominal muscles. And that will create a greater imbalance, causing them to shorten further, making them more susceptible to straining. We want to maintain the length of those muscles. The way to do that is from below the pelvis, maintaining balance between the quads and the hamstrings. So please, forget the idea of doing abdominal exercises as the way to resolve lower back pain. Please do not strengthen your lower back muscles. That's not the answer either. The answer to addressing lower back pain is to look below the pelvis. Look to the balance between quads and hamstrings. Remember, those are attached below the pelvis to the pelvis and have a much greater capacity to control the position of the pelvis, neutral, anterior tilt to posterior tilt. So by achieving balance there, you keep your pelvis neutral, which maintains the length of the lower back and psoas muscles. And that's how you prevent and control lower back pain. So that was a great point to make, Diane. I'm glad you brought that up, the Mckenzie thing, because I'm working with this other guy, and he goes on YouTube a lot and likes to show me all the worthless crap that's out there. And the promotion of the Mckenzie Exercises is a very, very big thing out there. Those wonderful fellows, what's the name? Brad and Bob, those physical therapists with the 1.5 million subscribers. They are big promoters of the Mckenzie concept. And I would defy anyone to challenge me by anything I've said in terms of the complete lack of value of doing extension. And in fact, the fact that it makes it worse. There is no possible way that anyone can say strengthening their lower back actually will help sustain the length of the lower back muscles. Does jogging create an imbalance between quads? Very good. Excellent. Very, very good. So when we look at functional activities, walking, jogging, walking up, climbing stairs, you'll notice that everything you do has a tendency to be done in front of you. Nobody walks backwards or jogs backwards. And as a result of that, there is a natural tendency for the quads to be stronger. If you just looked at those two groups of muscles, look at any picture, as a general rule, quads are much bigger than the hamstrings. So there is a tendency for there to be this imbalance. The question is to what extent that imbalance develops. If that imbalance develops enough to where that front of the pelvis can get sucked down substantially, then you're going to end up in a big anterior tilt, and those low back muscles, the QLs and the psoas, will become susceptible to straining. So your point is well taken. Do these types of activities lead to imbalances? Yes. So what has to be done as part of a regimen to allow you to be able to jog, run, go up hills, walk upstairs, any of these type things without having symptoms? The answer is strengthen the muscles that are required to keep that balance, primarily the hamstrings and gluteus maximus muscles, right? So what do we learn about Yass? We learn about Yass that those types of exercises are the exercises that allow for muscle balance to develop. for isolating muscles, making sure all the muscles required for activity, and for achieving balance of muscles so the muscles can be maintained at their optimal length, the bony landmarks are maintained in the proper position, and function occurs without symptom. There is no other form of exercise that allows isolation to develop. So whether it's that you want to sustain a jogging program, whether you want to swim, regardless of the activity, without doing Yass isolated strengthening, the highest probability is that that activity is going to lead to some sort of straining, weakness, or imbalance. And you're going to end up with symptoms. Doing an activity more does not make you stronger in doing that activity. Isolating muscles allows you to be stronger and allows you to do the activity not only with the limited chance of injury, but optimally, so it's more pleasurable to do the activity. Anytime you're using groups of muscles, remember, that should be described as an activity. Yass always promotes the idea of strengthening one muscle at a time, which allows you to isolate any muscle. That's why it's so important that that be at the core. It is the underpinning, the foundation by which all activities should develop. You have to start with the basis of doing Yass, and then you'll be able to go on and do your activities pain-free and fully functional. Great points, Diana. I'm so glad we brought that up. That's really good stuff. So just to reinforce, what's our point? Why are we out here doing this? We want to reach as many people as possible. So the best way that you can help me do that is to subscribe to my channel. The more we get that, the more YouTube is apt to suggest my information to people who are out there seeking information on the topics that I promote, as well as in terms of a Google search. When people search on Google, a higher impact on YouTube helps my Google search go up higher. So please, if you're liking what I'm doing, liking what I'm saying, you feel the information is applicable, please subscribe to the page, like the videos. In terms of Facebook, you could go to Dr. Mitchell Yass or at the Yass Method if you want to become a fan there. We also would appreciate that. I'm really pushing a lot of information out now, and it's typically coming through YouTube, Facebook, even on my website, mitchellyass.com. Again, mitchellyass.com. I have a blog on my website, and there's probably 80 to 100 posts there. If you want to contact me directly and you want to talk about your issue personally, maybe you feel uncomfortable doing it in this type of forum, by all means, contact me at drmitch@mitchellyass.com. I have the email address right at the top of the comment section. Again, drmitch@mitchellyass.com, drmitch@mitchellyass.com. Let's just, all you ever hear in the coronavirus is we're all in this together. Well, let me tell you something. In terms of the chronic pain epidemic, you are all in this together. You are all being misrepresented as to the cause of your symptoms by the completely baseless use of diagnostic testing, and yet that is at the initiation of every person who tries to seek care. You want to fix the problem? You want to stop the system from being fee-for-service, where regardless of whether you get better or not, that person gets paid? You got to band together. You got to help me reach more people. I would love to create a revolution. I would love to create a movement. I wouldn't even care if it's political. The platform would be one goal: to create a sensible and fair and proper means of helping people diagnose and treat their pain and get out of this stuff. Stop being a prisoner to the medical system and being able to live the life you so justly deserve. So let's all work together. Let's end chronic pain in the United States and globally. For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. See you soon. Bye-bye.